Hi guys, it's Dr. Mary again, day 6 out of 100. Today I want to talk to you about low magnesium. I think that if we're relying on blood tests to look for low magnesium, we're going to be disappointed because the majority of the time the blood work doesn't really show what's going on inside the cell. So what we have our patients do is look for symptoms. The top 4 reasons why most of us are low in magnesium is number 1, estrogen. So women suffer more than men, in my opinion, on a lot of the symptoms because of the estrogen. Stress or cortisol. So name somebody you know who's not stressed. I don't know one person who doesn't have a lot of stress going on right now. High intake of sugar depletes us of our mag. And in New Orleans and fresh off king cake season, I imagine that a bunch of us are deficient. And then a big hit for us here in New Orleans is alcohol. So when we drink alcohol, we really lose a lot of magnesium in our urine. So what are some of the things that you might suffer from if you're low in mag? Muscle spasms, trouble sleeping, for sure, cramping, leg cramps, that restless leg. We get a lot of great results with magnesium by starting that every night. Insomnia, having trouble falling asleep, staying asleep. Magnesium is such a great neuro-relaxer, as we've said in the past, but it really helps to calm you down, and that's why I'm such a big fan of Epsom salts and the ancient mineral oils that you can rub on your skin. And so I use something called OptiMag or NeuroMag that is a blend of a few different magnesiums, but I was taught by some of the best doctors like Carolyn Dean, and if you haven't read her book, The Magnesium Miracle, it's something to invest in, that you should try to get it from multiple sources. So using it in the skin, lotions, you can use lotions on people who don't want to take mag orally, but there are different salts that it's mixed with that's going to help to raise the intracellular level of mag versus just flooding the bowel like we talked about yesterday with the magnesium citrate and oxide. There's really not a high absorption inside the cell. So back to the blood work. When we order a mag level in a chemistry, that's really only measuring the extracellular level, and that's only about 1% of the mag that's in the system. The rest is inside the cell. So some other symptoms that you might notice are asthmatics. When I worked at Charity Hospital, the first thing we did when they arrived in Asthma Cube, if they were really in a severe attack, is we gave them 2 grams of IV magnesium. Pregnant mothers who are in preterm labor who are contracting. Mag is so powerful, it will stop an asthma attack. It will stop contractions of the uterus. So it's a very powerful mineral. It is essential. We need to get it from our food, but we don't get enough, obviously, because the soil is deficient. The trace minerals are not in the soil, and so I think you need to supplement. Some foods that have magnesium, back to my favorite, avocado, green leafies, nuts and seeds, and what else would you suffer from? Let's see, migraine headaches. We get great success with IV mag for migraine headaches. The nice part is that, again, we bypass having any GI discomfort or any problems with any loose bowels, and we're able to relax the vessels and get those headaches away. And it's a great use to prevent the headaches, hopefully. So I would challenge you, if you have a lot of migraines, and if you haven't tried using magnesium, you might consider it. The other thing you need to know is that vitamin B6 is a cofactor for mag, so it rides along with it and helps it to work better, and they need each other to work really well. So if you're deficient in B6, you're not going to really use up the magnesium like you should, and so those enzymes aren't going to happen. The other really important piece of information is that we need magnesium to be able to convert vitamin D and be able to keep bone in its the calcium in the bone. So osteopenia, osteoporosis, you want to look towards magnesium because calcium and mag are sort of on that seesaw in balance, and the yin and yang, it's very important to have to replenish the mag that we're losing. Let's see, what else? Sleep, muscle spasms, headaches, high blood pressure. That's another one where the vessels are just contracting and clamping down. I've had amazing success with getting people off of their blood pressure medicines by adding magnesium. So it's not something that you want to do without your doctor, but again, trying to turn to these natural agents and not always in a supplement. Try to look for it from your foods, because as you know, all of these great quotes, your food is your medicine, and it really does matter what we eat. But it also matters what we absorb. So in the future, we'll talk about the gut, But let's just start focusing on how we can reduce losing the mag. And we talked about that: sugar, stress. You can't change anything about the estrogen, but we can reduce the things that cause estrogen dominance, like soy and plastics and things like that. So, and then replenish with these other nice agents, like we said, Epsom salts, oral supplements, whether it's powders or capsules, and then the lotions and creams. If you have any questions, please text or message us or contact us at the Remedy Room. All right, have a good night.